is your advice for parents? When should they see a doctor?
What we suggest to parents who come to us is always trust your gut. If your child, as you see them, as you observe them, is already exhibiting certain things that were not, for something that you did not see in your older child, then you go to a doctor. Also, sometimes when they have cousins, you can compare. You go to a doctor. Also, if you have autism in your family, sometimes your family members can also give you guidance and, okay, that might be a red flag. Let's go and check. So our advice is, when in doubt, go to your doctor.
We've been talking about children most of this time, but adults can also have ASD. And this doesn't mean that they develop the condition in adulthood. Most likely, they were unaware that they had this condition or weren't diagnosed when they were children. Ms. Mona, what are the symptoms of ASD in adults?
The reason why people get to a certain age and not be diagnosed, they have a term for it. They call it masking. If your parent tells you you're not supposed to feel that, you're not supposed to do that, then the person tries to adapt. And this happens a lot in girls. They say that girls mask better than boys. We do see a lot of adults on the autism spectrum who have not been diagnosed earlier. In my program called ASP Autism Works, we try to find employment for those who are on the spectrum. And the late diagnosis applicants that we get usually go to their psychologist or their psychiatrist for other concerns. For example, they have difficulty in holding a job or difficulty in expressing themselves to their family or to friends. So these are other issues that bring them to the professionals, and with the professional, they get the diagnosis.
But another common misconception that I'd like to point out, which I think is very important, especially in the Philippines, because maraming naniwala na autism is caused by vaccines. But do we already have an idea on what causes autism?
There is certain predisposition in developing autism. However, we don't know yet what the specific cause is. So regarding the vaccines, I think the reason why people initially believed it was because of vaccines, because the symptoms come out usually at 18 to 24 months when we give the MMR vaccine. So maybe that's why they thought it was caused by the vaccine. So predisposing factors include genetics. So based on twin studies, families who would have one person with autism would have predisposition of having another child with autism. Other predisposing conditions include preterm delivery, high-risk pregnancies. So those are the more common ones that they think of as cause of autism.
With that wide range of people falling into the diagnosis of autism spectrum disorder, how specialized can that treatment be?
So the main focus of the interventions would be to minimize the core deficit, maximize adaptive functions, and minimize the coexisting conditions when they grow up. It should be individualized, so it depends on the needs of every child.
Ms. Mona, let's talk about some of the more common challenges that adults with ASD may have.
What I see as deficits would be inability or lack of tact when they speak. So they are sometimes misunderstood in the workplace. Another one would be their lack of desire to work in a team, and they would rather work alone. They excel in solitary activities. Another thing would be the stress that they receive when you give them deadlines or when they would have to socialize. Those are factors that for the rest of us that don't really matter, but for them, it gives them a high level of anxiety.
What are the basics when it comes to those with ASD? A lot of people may think that they need to have their space around them. They cannot be touched. Are these sort of misconceptions true? Do these still hold true now, or should that vary per individual?
Whenever I have sensitivity trainings, and I do this for employers, for example, you have to talk to the individual because they are so unique. then you have to ask them, how do you want to be called? Do you get offended when I call you autistic? Is it okay for you to be touched? Do you want a little bit more space? Do you need a headset? It's the same for when they are in college and when they are at work. So all of these things matter. And the key thing here is you have to ask them, you have to talk to them, you have to be with them so that you can find out more about individuals on the autism spectrum.
Now, for many people with ASD, living with this condition is not easy. When we return, we'll talk about this and how it affects their families. Your health is our mission. This is Medtalk Health Talk. Persons living with ASD often need support from family as well as other people around them. Now, we're here to discuss how you can help people living with ASD. I'm Dr. Freddy Gomez, and you're watching Medtalk Health Talk, where your healthcare always comes first. Dr. Catherine, what are some of the treatment management options with someone who is diagnosed with ASD?
We usually refer our patients initially for occupational therapy to work on their behavior so that the therapist could help them sit for a long time, pay attention when taught. This would also address their play and their self-help skills. So once they're okay already, we start speech therapy sessions so that they could be taught how to communicate. Also, we always emphasize that family support is very important. People in the house or the family should always support the growth of the child.
Are there tests to see if they can cope up with normal school? Dapat ba special school? Could performance in a normal school be a red flag na baka may autism ang bata?
The choice of school is dependent on the child's needs or the child's abilities. So if we see that they could comprehend, that they could answer questions, or sometimes we do academic testings in the clinic and they could do well in a regular school, then we advise them to be in a regular school. But some kids, they would have difficulties with reading comprehension. Then we suggest putting them or enrolling them in a special school.
Now, Mona, can therapy help someone with ASD function better in society?
They are very helpful in keeping a child engaged in the community. The speech therapy, occupational therapy are very important because these are pre-learning skills. But once they are older, like for now, like there's a pandemic, imagine a child on the spectrum stuck at home who cannot go out, who cannot participate in a community activity. So for the Autism Society Philippines, it has become very important. It has become a priority that we continue our non-traditional intervention by providing opportunities for them to come together on Zoom or on any other platform. It is important for them to flex those skills that they should be flexing if it were face-to-face.
Now, before we go, Dr. Kath, do you have any message for our viewers?
There is always hope in children with autism. When you have a gut feeling that something's wrong, that your child is not developing well, consult at once.
And Mona, any words to say for our viewers when it comes to ASD? And please share with them how they can get in touch with Autism Society Philippines as well.
Autism is a lifelong developmental condition. Those on the autism spectrum can live productive, meaningful lives with early intervention, unconditional love, and societal acceptance. You can go to Autism Society Philippines Facebook page, Twitter, Instagram for details. And let's join hands, cooperate in inspiring acceptance, accommodation, and appreciation for those on the autism spectrum.
This discussion was very helpful, I'm sure, for a lot of our viewers. Thank you, developmental pediatrician Dr. Catherine Baltazar Braganza and ASP National President Ms. Mona Magno-Veluz. Research continues to advance our understanding of autism, but there is still a lot more to learn. In the meantime, it's best to seek help as soon as you suspect that there is something off or something wrong. The earlier children with this disorder can get help, the greater their chances of treatment success. Stay safe, everyone. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this has been Medtalk Health Talk on CNN Philippines.